the World Health Organization, which has announced a new coronavirus strain called Covid-19 variant EG5 or Eris. Health experts, however, say there's no evidence that the new variant causes severe disease, despite an uptick in hospitalizations. So the big question, how concerned should we be here in South Africa? Joining us to unpack this development is Higher Health Chief Executive Officer, Professor Ramneek Ahluwalia. Very good afternoon, good morning to you. Thank you so much for joining us. Concern, of course, around anything to do with COVID-19 and looking at South Africa and the impact and really the aftermath of so-called COVID-19, pardon me. Is there cause for concern here at home with this new variant?
Good morning, Info, and good morning to everyone. Not at all, Info. This is a variant of concern for sure. Definitely it has become a dominant variant all over the world, which means in the current circulation of the virus between one human to the other, and the EG.5 is predominantly the variant that's moving around. We've seen more than 1,000 variants of concerns till date, variants of interest, sorry. But do they become a variant of concern? That's the question that we only wait from data to come from. The current data that's come from North America and China does not show any signs that this is more contagious or it's more lethal, or it is showing any difficult signs of, or it has become more dangerous, let me put it in a simple layman language, compared to its predecessor viruses, variants. You must also remember the EG.5 is still a subvariant of Omicron. You remember the fourth wave in South Africa was caused by Omicron. And then Omicron has been mutating quite rapidly, forming different type of subvariants. So this is another subvariant. For sure, what has happened is the subvariant has now become a dominant subvariant. So at this moment, no panic, no alert. It is not highly infectious. All the advices for people who are living with comorbidity, if you have hypertension, if you have diabetes, if you have cancer, if you are old, you still have to be careful, because now COVID is going to live with us. It's with us, it's around us, it has become a human to human. So as long as human mankind is now there, this virus will live. If you remember, we are in winter season, we had just flu virus. Along with flu, we had COVID, we had swine flu, and it's been moving around even in South Africa. But it has not yet been to a level that creates panic. So yes, there are hospitalizations, but there's early treatment, and there is possibility of people, and we have been able to minimize deaths out of COVID quite enormously. So which has good signs at this moment.
Yeah. So you say there's no need to panic at this stage, but is there a need for some concern with the increasing number of cases? Although the hospital beds aren't proving that, but looking at the manner in which COVID-19 spreads, should that be an area of focus at all at this stage?
See, there is definitely data of increased hospitalizations from America, United States. So this virus currently is, this new variant of interest is currently a lot in circulation in China and in America. And the data that's coming out is from these two countries. And definitely the hospitalization rates have increased, but the death rates are not increasing at all. Which means, the treatment available, the care available, early oxygen therapy, putting steroids, putting treatment mechanisms does save lives. So which means there is no need for overcrowding, because not everybody is going to severe infection. The challenge with COVID-19 is when it enters our human body, some bodies who probably do not have the immune system strong allow this virus to enter into lungs and formulate into a severe disease. And for that, when it enters the lung, becomes a pneumonic phase, you need hospitalization. But with the vaccines being installed, the immunity that remains in the human body, and the virulence of this virus, which is the infectivity or the strength of the virus, has tamed down so much that not everybody is entering into severe phases, which means our hospitals can manage the cases, there's enough support structures, there's enough strength of our medication and our treatment mechanism that's protecting lives, which is a fantastic news. And that's why we say no panic and no red alert. And all I'm requesting for people is vaccines do work, even if this new subvariant that's in place has clearly shown that this subvariant, very clearly the vaccines do hold the immunity against this subvariant. So people who have not got their booster dose, to please get their booster dose, because that's the immunity that eventually do not let a disease to become a severe disease. People will get infected, will be mild flu, and hopefully it should stay there. And in case you are old and you are with comorbidity, please report to a doctor with flu symptoms so that early treatment can start.
There's always, of course, a bit of a grey area, or perhaps a very thin line between the common cold symptoms and COVID-19. When should people really be looking beyond diagnosing themselves at home and really just getting professional medical attention?
It's a good question, Info. Symptoms of a flu and COVID are very similar. The reality is COVID is upper respiratory infection, predominantly in the nose, in the throat, the ear, and it remains there. You know, it still causes a lot of weakness. Flu still kills people. Old people, people with comorbidity still fall. We see deaths every year. We see hospitalizations because of that. COVID is still more severe than the flu. However, it has tamed down from its previous strains that we saw during the peak COVID umbrella in the years of the 2020, 2021, when we saw the Alpha, the Beta, and the Omicron waves that hit South Africa. But yes, if your immune system is low, the COVID can go into your lungs. So when you feel shortness of breath, you know, when you feel pneumonia kind of symptoms, you know, your cough is becoming severe, your fever is not coming down, you should, and anybody, whether you are living with comorbidity or old, should seek medical attention, because that is where the early treatment can begin. And early treatment saves life. Early oxygen saves life. And there are then many mechanisms. So it's very critical for you to observe your flu and to what extent your body can take that flu. And in any level you can't, you must go to the medical system.
Very well. Thank you very much for that insight, Professor Ramneek Ahluwalia, speaking about the new EG.5 COVID-19 strain that's making its rounds, especially around the U.S., the World Health Organization classifying it here, and of course the professor saying that there's no need for panic here at home.